Okay, I accidentally just started a new video, so we're just gonna pick up where I left off. So I was sitting there and I was like about to say atrial valve, like over and over. I was like, it's not atrial valve. Why do I keep thinking that? So I'm going to listen to your aortic valve at the second intercostal space, right of the mid-sternal line. Then I'm going to move laterally to the pulmonic valve. And then I'm going to go down to the fifth intercostal space left of the mid-sternal line and listen to her tricuspid valve. And then I'm going to move over left, still at the fifth intercostal space, and at the mid-sternal line, and listen to her mitral valve. Okay. Heart sounds have regular rate and rhythm. I'm now going to assess clients' breath sounds by listening to the lungs anteriorly and posteriorly. Okay, Barbie, I'm just going to listen to your lungs for a minute. And I'm not going to lie, I still have a little bit of trouble with how many positions I'm supposed to listen to on the lungs. So if you guys want to fill me in on if it's 3 in the front, 3 in the back, or if I have to do all 10, really not sure. Okay, breath sounds are clear to auscultation, and I see no signs of accessory muscle usage, and I see no nostril flaring, as I noted earlier. Okay, Barbie, I'm going to move down to your stomach, and I'm going to listen to your stomach a little bit, okay? So I'm going to assess client's gastrointestinal system, starting by auscultating the right lower quadrant and moving around, and then by palpating. Okay, bowel sounds are normal and active. Okay, Barbie, I'm going to touch you on your stomach, okay? Can you tell me if this hurts? Any tenderness here? How about here? Or here? Okay, perfect. Can you tell me when your last bowel movement was? Okay. Have you noticed any strange texture or color, odor, anything unusual about your bowel movement? Okay. How about any nausea, vomiting, diarrhea, or change in appetite? No? Perfect. How about pee? Are you peeing normally? Okay. Do you know about what color it usually is? Great. Have you noticed any change in frequency or color or appearance? Okay, that is great. So, gastrointestinal system appears normal. Okay, Barbie, now I'm going to look at your hands and your feet. I'm going to assess patient's pulse bilaterally, radial pulse and pedal pulse. So I'm going to start here, Barbie. I'm going to feel your pulse on your hand and on your other side. And pulses are a 3+ bilaterally. And now I'm going to get her pedal pulses bilaterally, and they are a 3+. And I'm going to assess the patient for a capillary refill. So Barbie, if you'll just give me one of your fingers, I'm going to squeeze on your fingernail. And cap refill is less than 3 seconds. And now I'm going to squeeze one of your toes. Okay, cap refill is less than 3 seconds. Okay, Barbie, can you hold your hands out like this and show me your fingers? Great. I am noting that there are no signs of clubbing present. And now I'm going to pinch on the back of one of your hands, okay? And skin turgor appears brisk. Okay, Barbie, we're going to do a couple of little exercises with your arms and legs, okay? I'm going to assess client's range of motion and strength in the extremities. Okay, Barbie, can you hold your hands out to the side like this? Great. And can you bring them in front of you like this? Good. Now, can you push up on my hands with your hands? Great. Can you push down on my hands with your hands? Awesome. Thank you so much. I'm also going to note at this time that the upper extremities, the skin is intact, of the correct color, dry or moist, warm and moist. Okay, Barbie, I'm going to touch on your feet and your legs. Can you push out on my hands? Good. And can you pull my hands back? Great. Can you push out on my hands over here and pull my hands back? Great. Thank you so much. And can you put your knees together and then just one at a time, raise them up? Perfect. Thank you so much. So I'm also going to note that the range of motion for upper and lower extremities is normal and strength is good. And the lower extremities also, the skin is intact and of the correct color, moist and warm. Now I'm going to look for any pitting edema. So Barbie, I'm just going to push on your legs one more time. And pitting edema seems to be 0. I'm also going to go back and reflect on the fact that the client's skin, anterior and posterior chest, the skin is also intact and of the correct color. And the client has no evidence of any DVT prevention on them. And the last thing I'm going to check are her bony prominences and the back of the ears. And I'm noting that the elbows, the scapula, the sacrum, and the back of the ears, all that skin looks to be intact. And Barbie, that's going to complete your physical assessment today.